And I have to thank you for inviting me to talk here, and I'm really honored to talk with such distinguished researchers and MDs and so forth. So we all have the common goal here. So research is so important, and I'm so glad there are persons like Judy Mikowitz who are doing this great research work. I'm sort of mostly clinician. I really want to help with research. I give every help that I can, but my main work is to treat the patients. But I need the research behind me to save me from the officials, because I'm daring to treat disease that in their mind doesn't exist. Or is to give me, and of course to give me new ideas and weapons. And I liked Dr. Mikowitz used the word war. This is war. It's war within a community and also in nature. And I used to use antibiotics in my clinic a lot. I'm more and more using exclusively herbal treatments, sometimes antibiotics, but I was glad to notice that we can just as effectively, maybe even better, treat with herbals. And I'll try to explain to you why this is. So it's nothing new that we are taking help from nature. Every year the medical industry is using ideas from nature and trying to harness it for developing new medicine. But of course they have to change it, because you can't patent something that nature made. So you have to change it or take something out of it so you can make a patent and then sell it in your name. And this is a picture from after World War II in the northern Finland. And I think this tells me what our work is. The enemy is gone. The enemy armies are gone. Okay, they might be hiding in bunkers, like Borrelia might be hiding somewhere. But basically we think the war is won. But is that enough? Because the houses are burned. There's no electricity, there's no heating, there's no water, there's no food. So you're not going to be a very happy camper there, right? So really big part of our work is to rebuild. You have to rebuild everything in order for your organ system to work. And these are very nice pictures of there's Dr. Schwarzbach being together with, there's a university group in Jyväskylä in Finland who are doing a lot of research with Borrelia and with antimicrobials. And on the left side you can see the spirochete form. Then there's the blebs, which are actually there to confuse your own immune system, and they are actually transferring DNA between each other. And we know, at least from other bacteria, that even different strains of bacteria are talking with each other, teaching, if I learned how to resist this antibiotic, oh, I'm going to tell that other guy that too. So that's why the resistances are spreading so fast. And then there's the round body, or the cyst form, the second from the right. And that's very resistant to antibiotics. And then the biofilm form. And there's very recent research by the Ivasapis group that they have actually now from the human tissue found the biofilms. So we're getting more and more evidence that it's really there. And the biofilms and the round bodies, or the cyst forms, are the big challenges for us, because the biofilms, it doesn't matter what you're giving, they can only kill the outer ranges of this big blob. So you have to sort of crush it to be able to kill everything inside it. And also these infections, they are stealth infections. They can hide and they can mutate their own outer structure. So if we develop a medication that is supposed to recognize some structure, and this guy goes and changes it, then the medication won't work. And it will disrupt your own immune system. Like it's such a, like Dr. Schwarzbach said, it's such an important part of the how to get well and how to fight these infections, and these infections can impair it. And the cytokines, they're a big favorite of mine. And you will see how I also treat them. And they suppress the detoxification. Heavy metals, other pesticides and toxins, we really need to get them out. And it can disrupt the body in so many levels, the thyroid, all the hormones, the sex hormones. It can disrupt your gut and sort of every living organ. So it's not just about killing the infection. And the gut hyperpermeability, the leaky gut, is nearly every single one of my patients have this. So that's really big part of the treatment. With the ones that the gut is really in a bad shape, that's the thing we start with. We won't do anything else before the gut is at least a little bit better. And of course the Herxheimer reactions, which we all love and hate, it can be a challenge to balance between the effective treatment and how much Herxheimer reactions you can take. So I really like Dr. Horowitz's MSIDS concept, and I'm using this as a helping tool in my work. So many times with the most ill patients, oh sorry, I'm always pushing the wrong button. With the most ill patients, I may have to go through every single last one of these things. And I think actually the more I've done with the chronic infections, stress and toxins are the two really big things. And you can see it actually that somebody, if we're wondering why isn't she getting better, it could be that she has such immense stress in her life that she hasn't been able to do something about or learn to cope with it, that's obstructing the getting better. And I thought that I would give you sort of step-by-step ideas of how I've treated. So even if you're a patient or a doctor, you want to know how to get better and how to help. This is what, with actual patients, what I've actually done. And this is a 64-year-old male who had been very active physically, and he was actually still working. He's a massager, so he's doing physical work. And he'd been very healthy, like, antibiotics are freely dealt out in our healthcare system, but he hadn't needed antibiotic treatment before the age of 30. So he had just had few bronchitis. It's interesting that he had liquid in the lungs at the age of 11, and nobody knew the reason. So you can think maybe there had been something already there. And the mild psoriasis, and again, of course, nobody thinks anything about it. No allergies known. He had lost his vision in the eye, one eye, cause unknown again. And he had fallen ill quite rapidly. He had severe pneumonia 6 months ago, high fever, and his wrist and knees got swollen and very painful. And they treated the pneumonia with high doses of antibiotics and 3 different courses. But even though the pneumonia went away, he still had these swollen and painful wrist and knees. And they put him to a rheumatologist who said that it's a seropositive rheumatoid arthritis. And they started very heavy-duty medication on him. They did do some infectious disease, probably because of the pneumonia. So mycoplasma antibodies were negative. In Finland, they only measure IgG and IgM, and not the IgA like the Armin Labs does. But the official site will only use their tests. And chlamydia pneumonia antibodies were negative. Again, IgG and IgM. The rheumatoid other tests were negative, so there wasn't anything there. So the medication, you have a bit different names for these in Britain, but there's corticosteroids, and there's this heavy immunosuppressant, chlorine, Trexan, citalopram. So he had the maximum medication, sort of, and he still had all these symptoms. They didn't do anything for his so-called rheumatoid arthritis. So, and he was shivering and had the feeling of fever, alternating. So there was still signs of an infection, but they all thought it's just the arthritis. Sometimes difficulty breathing and the ringing in the ears. Insomnia. He woke up constantly, like only half an hour or hour of sleep, and then he would wake up. And he had also dropped weight, so we use kilograms in Finland, but this is a significant weight drop. And when I listened to his lung, there was a slight phlegmatic sound, a little bit, but there wasn't really anything special otherwise in the clinical picture. The swollen wrists and knees were clear. So I ordered more tests because, I suspected he will have a load of infections, and I wanted to measure vitamins and minerals. He had what we call a typical Finnish diet, which is sort of probably quite the same as in Britain. And of course, our officials say that that's going to be enough for everyone. You will get enough vitamins and so forth with this diet. And but while waiting for these results, we already gave him some advice that he should try gluten-free, dairy-free, and our nutritionists also suggested no nightshade veggies because of the arthritis, and no sugar and preservatives. And just the sort of little basic vitamins that I could guess without the lab results that he would need. High quality multivitamin. Vitamin C I prefer to use either in natural form, so powder made from berries or something, or the liposomal vitamin C. And vitamin D, in Finland at least, we have a great deficiency of vitamin C because of our long winters. And magnesium, there's always shortage of magnesium, and these infections will make it worse. And I will use a higher dose of zinc than I would use for some other patient. So even though the multivitamin that I use has 50 milligrams of zinc, I always put at least 30 milligrams on top of it. And for him I chose a Krebs Plus, which has acetyl L-carnitine, alpha-lipoic acid, Q10. Q10 and alpha-lipoic acid will give energy. Alpha-lipoic acid also detoxes, so we are starting the detoxing right away. And acetyl L-carnitine is very good for the brain. So if you have some memory problems or something, that's very good. B12, always either orally or injections, or we can give it IV too. probiotic always, and iodine. There's usually deficiency of iodine as well. And some form of oil, fish oil. Some Lyme patients can't tolerate fish oil. They, for some reason, get headache. Then we use these like udosol or something that has plant-based oils in it. So when we got the test results, you can see the Borrelia Western blot was negative, and ELISpot for the Burgdorfer was negative, but the mix, which has the other sensu stricto and others, it was borderline. And chlamydia pneumonia was positive, which was sort of logical, given his history. And Coxsackie virus, we see a lot of Coxsackie in Finland. Armin knows that. He's getting all our samples, so maybe 80% have Coxsackie virus. Ehrlichia was borderline, and we see a lot of Ehrlichia and Yersinia, yeah. And CD57, he happened to have it sort of in a quite good range, 142. So let's look at his nutrients. I didn't put the numbers because we used different measurements than you use here in Britain, but he was deficient in everything with this typical Finnish diet. So we were right to give him everything. So we had to add iron as well, because I use whole blood measurements for zinc, iron, magnesium, and so forth. So if you're measuring them from serum, you won't get accurate results. So I had, at the first visit, I had already said that I suspected you have chronic infections, but it might be difficult to treat them because you have such high amount of these drugs that are using for the arthritis. And he had actually made his own decisions waiting for the results. He had changed his diet. I give him full credit for that. And he had taken everything we told him to do. And no pains, no fatigue when he came back. And he had stopped on his own all the medications, and he was doing fine. And side note, which we hadn't even talked about, he mentioned that, oh yeah, I had this elevated blood pressure, and it's now good without medication. So I wanted to give this case to you because this is one of those patients that have dramatic response just to the change in the diet and the basic vitamins and so forth. It's maybe about 5% of our patients. Okay, I get very hard cases, so we don't get easy cases at our clinic. But even from those, 5% get asymptomatic just with these changes. But I didn't want to trust that the fight was over just with this. So we thought that, still a herbal protocol. I didn't see necessary to put antibiotics here. I thought, herbal protocol. He didn't want tincture form. He felt that capsules would be easier for him. So we tried with that. And when he came for a follow-up, he was still feeling good, no symptoms. And we added transfer factors which support your immune system and the attack against, so especially the viruses can be difficult to treat. And Coxsackie is one of those that if you're using viral antibiotics, they won't help. So actually, with the Coxsackie, you need to use herbs. So olive oil extract and reishi are some of that are very good against Coxsackie. I've been trying other herbs now as the time, because this was a few years ago. So I was keeping the protocol quite simple for him, because he wasn't motivated to take, because he was symptom-free. So he's not going to take a load of everything. He still had regular visits to his rheumatologist, who always said that, you're having a symptom-free period. You have rheuma, but you just happen to be symptom-free, and it has nothing to do with your change in diet and so forth. So he has a great sense of humor, so he had a good laugh always at the rheumatologist. And rheumatologists still wanted him back on Trexel, on these heavy-duty drugs. But he luckily said no. So, but there's another surprise. Like, this is a good example. At the beginning, the Borrelia burgdorferi was negative, the ELISpot. But now, after taking treatment, it was clearly positive, 22. And also the other strands of Borrelia, 24. Chlamydia pneumonia was maybe getting a little bit depressed under the herbal medication, so it was borderline. Coxsackie virus was still going strong. And that's why I, at this point, added these olive leaf extract and so forth, because clearly the basic protocol wasn't enough. And here you can also see that what the problem is, because we don't have a sort of a system like in the States that they have this insurance that would pay for everything. Our patients have to pay everything for themselves. So sometimes they can't take some tests because they simply don't have the money. And well, at this point I said, the ELISpot, the capsules won't do at this point. I want you on tinctures. So wife and I gave him no option. The wife was always with him at the, I love them. It's a lovely couple. We always have a good laugh and we're joking about things. So we gave him no option. It's tinctures or nothing. And I used Cowden protocol that it's handy. If you start with the monthly packages, it has the written instructions. So I lowered his step to start this. But I put the Tacuna on that for viruses. And Avea, which has curcumin, I really love it. It takes down the inflammation. And this is about the cytokines. Actually, for some patients, if they can afford it, we measure the cytokines. And there's lots of research about these different herbs, which cytokines they affect. So you could actually do very specific treatment for cytokines. And for insomnia, he still had that, so we added Amanita drops, which is valeriana root. Okay, at the next control visit, everything was already negative. I rarely see this fast reaction. Usually it would be, around +10 or +7 from the over 20. But here he reacted very, very fast. And you could see that his CD57, which wasn't bad at the start, was now very good. So we had supported his immune system. And that's what we see with our patients. They suddenly, even though they're carrying all these chronic infections, they tell that they are otherwise the healthiest ones in the family. So they will get no flus and stomach flus or anything. So everybody else is falling ill and they are just going, even though they should be the weakest ones. So plan. Wife and I leave him be. If he promises to take the basic vitamins, and we just left a few herbs there, and he has to keep the healthy diet. And we put the adrenal support. It has a few herbs that supports the adrenals, but now there's also evidence that it does make your immune system, the CD57 and so forth, the cells more effective. So it actually supports your immune system as well. And he was supposed to have his 2-year checkup after being healthy, and he just canceled it and phoned me that he's feeling so well that he doesn't really see the need to come. And that's my job, to make myself redundant. So, job well done. Okay, so a few words about the immune system. You don't really have to look at this picture. I just wanted to demonstrate, there are many cells at play here, and they all have different roles. And it is really your best army in this war. And so it's all right. Don't worry too much about washing your clothes or whether you can hug or kiss your children. Take care of everyone's immune system. That will kill. And they have a sentry system. They have guards protecting the boundaries. The gut is very important. We have hydrochloric acid here in our stomach, which when the bacteria drops in it, it's a pretty effective way of killing things. And we have rapid response units that will get to the site of infection within minutes. And then there's messengers who are going to every corner of your body to call out more help to that site of infection. And they have these units with long memory, probably sort of like wives who will be, I remember. So they are there to ensure that if the same enemy comes to you again, it's even faster, this response. And they have direct attack, like these CD57 cells, who will attack directly. And then we have the indirect attack, which, so they are using everything they've got, chemical, biological weapons, anything. This is dirty war, no rules. And there's training camps where they are trained, your immune system. And if something goes awry, if everything's not right, and like these infections can do that, your immune system, your soldiers can become too enthusiastic. So they can start firing at everything, even your own organs, like your own thyroid. And then we have autoimmune disease, or we have allergies. We are reacting to everything we eat. So then, again, it's actually not the food that's the problem. It's your immune system that we need to get into balance. So how do you take care of your army? Keep the supplies coming. The soldiers won't march without food. So it's a healthy food, it's the vitamins and minerals, and you have to have a healthy gut that you get the vitamins and minerals to the soldiers. And don't overwork them. When you are ill, my father-in-law is a very enthusiastic marathon runner, and I'm very proud of him. At the age of 70, he's still doing marathon. But when you have these chronic infections active, that's not a good idea. And you should diminish stress and learn stress management. And usually the kind of exercise that works best at this situation is sort of meditative yoga or sort of muscle training. And go dancing only when you are feeling up to it. And you can support your army with the herbs. So especially the anti-inflammatory herbs are very important here. And the killer cells, like the CD57, I love this picture. Your history says. So they are attacking. These are straight attackers, and you need to take care of them. Okay, there are problems with the CD57 measurements. We know that they may be going up and down and so forth. So you always have to. You're not treating lab results. You're treating the person. So it's always what the patient is feeling like and the lab results, and you throw it together and not just look at one thing. So another case. This is a 49-year-old woman, mother of 5. Okay, you might say it's no wonder she's tired, but it was actually, the last giving birth was 202, so we could expect her to be feeling a little bit better. She had lost 4 liters of blood, and so she had gotten blood transfusions, and there's no testing in Finland for these chronic infections, so who knows what she got from that blood transfusions. And she was fatigued ever since. And like most of my patients, she had been told that it's all in her head, that she's depressed, and she had been put on all kind of depression medication. None of it helped, which is also often that she got this hypothyroidosis diagnosis. 2006, again, the medication didn't really help her. And she had so many symptoms, very severe pains and fatigue, shivering, loss of hair, dry skin, diarrhea, palpitations, insomnia, poor memory, lack of concentration, no strength to exercise. So very, very typical picture of symptoms, what I see. And muscle weakness. She was very high-strung, very anxious, and that's also these. Sometimes I ask from the patient, is this something? Have you been, sort of anxious sort of person in earlier life, or has this come with this illness? And they often say yes. It's this illness. I wasn't like this before, and these can affect the way your brain. Some become aggressive or depressed, but this anxiousness and stressfulness is very common. So she had been in another clinic, diagnosed with Borrelia and chlamydia pneumonia. They hadn't tested anything else, just these 2. And she had been given IV antibiotics, azithromycin, for 6 months. I get patients who have been giving IV antibiotics for a year or even 2 years. And then the first job is to detox. And she also had artemisinin and doxycycline, rifampicin. So she had actually had a quite extensive antibiotic regimen, but it had done nothing. No improvement in health. And she had constant sinus infections despite the antibiotics. And we did more tests. So Elisabeth Borrelia Buchhofer was 42, and the mix was 60. But they hadn't tested before the Coxsackie virus, which was clearly positive, and the Anaplasma or the Ehrlichia was positive. She had low CD50 count. This is not the record. I think the record I've seen was 13, but this is low. And we looked at her gut because she had this constant diarrhea. I use PCR test for the stool bacteria, so we see more than what we would see with culture. So she had elevated E. coli, Klebsiella, Clostridium, and Enterococcus. And I use these, I treat these with herbs also, so they work very well for these bacteria. And also problems with digestion, elevated protein and fat. So we knew that she probably had deficiency of hydrochloric acid and the enzymes. So she wouldn't get everything that she needed out from food. She would be deficient in vitamins and minerals, and her immune resistance to infections from that part would be impaired as well. This is another thing we see a lot. If the IgA in the stool is low, it means that they have a diminished resistance to infections, and heightened risk for IgG food intolerances. And we test a lot of these IgG food intolerances. It can be a big part of why you are tired. So it could be that the infections are gone, but you're still tired. It could be that it's something you're eating and you just don't know it, that it's making you ill. She was very skeptical of herbs, but I told her, you know, you've been taking all these antibiotics and you're not getting better, so let's try something else. And she was already eating a healthy diet, so we didn't have to do anything about that. So the nutritionist only made small changes and suggestions and sort of advised more alkalizing diet. And we put the basic supplements, sort of the same ones that with the first patient. So, and then we got the IgG test and we changed the diet along that. She actually had IgG intolerances for cow's milk and gluten and egg. So it was important to take those away from her diet. So we started the Cowden protocol supported with other herbs. I will go over those later. And we wanted to do a number of things with her. We wanted to detox because she had had so many antibiotics. Because she had such a severe fatigue, I suspected that her mitochondria, the energy factories of the body, would be impaired, and we need to repair them. And we wanted to support her own immune system and also the immunomodulation, that we want to get the friendly fire from there away. And healing gut and repair. So you can see this is quite a lot to do. And we have to start from some point and do what we can at this point, and then when she comes for control visits, we can do more. So I was guessing that she would need double doses of the antimicrobials from the Cowden protocol. Very many of my patients, the typical dosage is they're 30 drops twice a day for the antimicrobial herbs. It's not enough, so we're using double doses, sometimes even triple. Mapalo is a herb that I like really much for regeneration of the neurological system. Resveratrol for the inflammation. Andrographis also is killing. Resveratrol has a bit of a anti-Borrelia effect, not so much as the Japanese knotweed, but some. Andrographis it's also making the herbal protocol more effective, so it's killing Borrelia. And artemisinin, it has effect for many things, but especially we're using it against Babesia and other parasites. Tacuna, again for the virus infections, and curcumin drops for the... we've seen very good things with this curcumin in the tincture form. Many with allergies like pollen allergies, they don't need any allergy medication anymore. We've had patients with severe asthma, and when they are on these curcumin drops, they can either start the asthma medication or at least lower the dosages. So I have to have a special reason not to use that. And for the anxiousness, I suggested that she could try these drops that she could. They won't make you tired. They will just sort of ease out the anxiousness. And multivitamin, for her, I put it extra B vitamins in a bioactive form because she had so many problems with her gut and to get the nutrients inside her, that I wanted them in a bioactive form. Phospholipids, again, vitamin C, D. For women, many times they need higher dosages of vitamin E. The multivitamins usually have it, but sometimes I want higher dosages. And magnesium, and for special mitochondrial repair, ATP fuel, energy multiplex, liposomal glutathione, NAC, and for the detox NAC and cilantro or other, what do you call it? Okay, it eludes me. But so I put a little bit more of these to, because she was more severely ill than the first patient. So she made me swear that I would start the antibiotics if she didn't get better. And I said, I promise I will if you don't get better. And on a 2-month follow-up, she was feeling clearly better, more strength and energy, still a bit feverish and sweating. This is actually something that my husband made me do when I'm a Lyme survivor myself. I was very ill. I was totally bedridden. My legs wouldn't carry me, and I just only wanted to die. So I know what this illness can be like, and that's why it's my calling to help others with this. And my husband took care of me, never a crossword, never complained, and because he could see that I was so down, he made me put a number on each day. So like for a feeling, if it's from 1 to 10, if 1 is when you're wishing to die and 10 is when you're feeling great, you're not going to feel that good when you're number 3 or 4, but if you've been at the 1, then you get perspective. You can remind yourself, okay, I was 1, and now I'm 3 or 4, it's not great, but it's better. And I use this with my patients. And with her, I ask her to give a number for her pain and fatigue. So she started at 10 with pain and fatigue, where the pain and the fatigue are so excruciating that she couldn't imagine them any worse. And at the follow-up, they were at 5. So I was very, very happy with that. That was very fast. It doesn't always go this fast. She was still feverish and sweating, so I suspected Babesia. But I didn't put anything extra yet because I knew that Cowden protocol changes at month 3, in the middle of month 3, when the herbs change. And those herbs that are starting at the middle of month 3, they are more directed against Babesia. So we waited for that. And at 4 months, she had been on the Cowden protocol, and the shivering and sweating had stopped when she switched the herbs. And she was going back to work 20 hours a week, which is incredible, thinking of how ill she was at the beginning. I reminded her, you're going back to work now, but don't overdo it. You know, there's going to be more stress, and so you need the stress management skills here. And so we added adaptogenic herbs more to ensure that she'll get better. So again, the pain and fatigue were a bit better. And with the lab results, you can see the Borrelia ELISpot already gone down to 5. These were still positive, even going up. Chlamydia was already negative. Coxsackie was negative. This was fairly easy, Coxsackie, to treat. It can be much difficult. And I think more and more I'm seeing patients with 6 to 9 different virus infections. And the viruses and Babesia can be much more difficult to treat than Borrelia. But it's just the Borrelia that we are talking most about. But actually, when treating, it's not the baddest guy in the town. Ehrlichia was negative. Her CD57 was a little bit better. Still not great, but a little bit better. So we talked that you still need to continue. Okay, you're feeling good and you're going back to work, but you need to continue. And we wanted to more the cytokine balancing, so low dose naltrexone, autolysated E. coli injections to the muscle. We use IV ozone and glutathione and vitamins and so forth at our clinic too. And at 6 months, she was feeling good. There had been a Christmas between that, so she had ate some sugar and milk products, of course, chocolate. So some of the symptoms came back. So that was a great learning experience for her to see that it is actually important what you're eating. So when she has been healthy for a longer time, she doesn't have to be that strict with the diet. But when she's ill, she can feel it. So now she's sticking to the rules and feeling good. And she was already working full-time and started light exercise yoga. At 7 months, she just came for a checkup, and I was glad to see that these are all negative. She didn't want to put money on these tests anymore, but these were important to see. And she's actually, there was another good lesson. Between this and the last, she had a difficult divorce. So she's now a single mother of 5 and working. So there was a little dip, so she got some of the symptoms back. But now that she was sort of getting into grips with the divorce and such, the symptoms receded. So that's also a reminder about the importance of stress and stress management. So her plan has been, we actually, now that the results, this is actually old one from the old earlier visit, now we are dressing down her herbal protocol because the tests were already negative and she's so good. And the general recommendation is full protocol until 2 months feeling good, and these results should be normalized. Many of my patients need parasite cleansing. For some, the herbs in the protocol might be enough, but for some you need all you can get. Parasite infections can be very, very difficult to handle. And babesia is another one which can keep cropping up again and again, whether you're using the drugs from the medical companies or the herbs. It can be one of the most difficult ones to treat. So some of them need artemisinin on top of, I like Chancapiedra and Quina. And there's actually, I haven't written here, there's Crypt Plus, which has several herbs that are effective against babesia. So some of the difficult ones need all of these. So when are you cured? When the test results are good and you're feeling good and energetic. So like I said, we are not treating just the test results. When a patient comes to a control visit, I won't even look at the test results before she has told me or he has told me how she's feeling. That's the most important thing. Only after that, I look at the test results, whether they support the story or not. So when the patient is feeling good and energetic, so I don't just want, I'm okay. I want them to feel great. So don't be fooled by isolated ELISpot results, because these are stealth infections. So they could sometimes be, the ELISpot result could be negative, but if the patient is telling, I'm just so tired and I have these pains and so forth, then the negative result is probably not true. So, and you always have to remember that the persistent symptoms can be about the other things with these infections. So it's not only about killing, it's about rebuilding and getting the cytokine balance back, repairing the mitochondria and getting out the toxins and the stress and so forth. So if somebody is not getting better, I go back to the drawing board with the MSIDs and check what haven't I checked before. Okay, last, actually my husband asked you to tell about this TICPLEX university project in Finland, and there's always also Army Labs together with this new test which might enable us to test for more infections with a lesser cost. And there's actually a survey for patients and for professionals, so they'd be really grateful if you could go online and fill it so they get information, what you would wish and what you would need. Okay, thank you very much.